Welcome to my channel. In this video I will discuss sepsis and its management. Sepsis is when the body has an unusually severe response to an infection. Unusually severe response to an infection. It is also known as sometimes septicemia. During this condition, the immune system that defends us from germs releases a lot of chemicals, cytokines into the blood, and it triggers widespread inflammation that can lead to organ damage. It is seen in case of severe immune inflammatory response syndrome. Here you can see from sepsis, S stands for shiver, fever or very cold. E stands for extreme pain or general discomfort. P stands for pale or discolored skin. S stands for sleepy, difficult to rouse, confused. I stands for I might feel like I'm dying, and S stands for shortness of breath. So these are general signs and symptoms of sepsis: shiver, extreme pain, pale, difficulty in arousing, feeling like the person is dying, and shortness of breath. Management. For management, first you should perform cultures so that the culture should be taken from urine, sputum or any vascular lines or wounds, and prompt administration of antibiotics are then done according to the probable causative organisms. It may be based on the previous organisms or previous infections, may be based on previous antibiotic therapy. The early stages of septic shock are often dominated by hypotension, with relative volume depletion due to marked arteriolar and particularly venular dilation. Sufficient IV fluid should be given to ensure that the intravascular volume is not the limiting factor in determining oxygen delivery. So first step is cultures, prompt administration of broad spectrum antibiotics, and sufficient IV fluid administration. So these are first steps. Then vasoactive drugs are given. These vasoactive drugs improve the circulatory system. For example, we can use inotropic drugs or any dilating or constricting properties of these drugs in most of cases are used. A vasoconstrictor such as noradrenaline, norepinephrine is necessary to increase systemic vascular resistance, and BP, while an inotrope may be necessary to maintain cardiac output. Inotrope is given to maintain cardiac output, and noradrenaline is one of the most important drug that is used in the shock, and it improves the circulation. Corticosteroids can also be given, and why these are given? Because most of these patients may have adrenal insufficiency due to loss of blood flow. Due to decrease in blood flow, these patients have adrenal insufficiency, so these patients will require corticosteroids, and corticosteroid replacement therapy is controversial, it should be remembered. Although it is associated with earlier resolution of shock, it has no effect on survival. Why it is associated with earlier resolution of shock? Because corticosteroids depress the inflammatory reaction in the body, because these depress or suppress the immune system. So this is all about sepsis and its management.